coffee slows and even stops the growth of prostate cancer. Dr. Richard Chaffoo is here to explain more. Doctor, good morning.
Good morning, Raoul.
This seems like it's pretty good news. Tell me what the study found.
Yeah, so the study was actually a group of researchers in Japan, and they looked at mice, and what they found, Raoul, was in mice that were actually given these two hydrocarbons that are found in coffee, they reduced the growth of cancer by 100% compared to a group that were actually not getting these two hydrocarbons. So at least in this pilot or preliminary study, seemed to slow the growth. And these were actually in drug-resistant prostate cancer.
Yeah, I mean, any signs of hope.
Yes.
This is the research we're always talking about.
Exactly.
Why is prostate cancer so deadly? And if you could explain, do we know what causes it?
So we don't unfortunately know what causes it, and the reason it's deadly is that there are no symptoms early on when it's confined to the prostate. When it metastasizes out to the lung, the liver, the bone, then of course symptoms can be present at that point when it's more advanced.
That's for men. It's always get that prostate exam.
Yes.
Have they changed the years and the age? When are you supposed to go get a prostate exam? What's the age now?
So the age is at least the age of 45.
Okay.
And then there is a test called a PSA, or prostate-specific antigen. There are certain centers like Memorial Sloan Kettering are recommending at the age of 45 to get an initial screening PSA blood test, and then your doctor can monitor or follow that.
And the key here, this is one of the cancers that if caught early, it can be treated.
Oh yes, absolutely. In fact, unfortunately, in the United States, 85% of men that are diagnosed with prostate cancer are diagnosed at early. 1 in 9 men in the United States will get prostate cancer in his lifetime. So it's the second most common cause of cancer deaths after lung cancer.
Yeah, so you have to get those tests done. You have to get the exams. Okay, getting back to the coffee. How much coffee are we talking about for this particular study?
Right, so we don't really know, and of course this was a study that was done in mice. So and also the fact is that this is, we have to remember that this was the hydrocarbons that oftentimes are filtered out in coffee.
What happens next? Because we've heard a lot about studies and things that are happening in research, and then we never see it come to fruition. It never turns into anything. So what happens next with the success they've had with mice and potentially down the line helping people?
Of course, and this is what these researchers said. They were excited by the initial pilot study to see there may be a causal relationship, but now they need a longer study in mice, in an animal model, and then of course a longer clinical study in humans to see the benefits and the effects.
That study aside, are there any other benefits of coffee that we could look at?
There may be. You know, the World Health Organization took coffee off of being a cancer-causing or carcinogenic agent, and there are some associations between coffee and perhaps other diseases like Parkinson's disease, cirrhosis, liver cancer, type 2 diabetes, and gout.
A lot of people hear on the news about these studies, and we were just chatting about it last week. It could say coffee's bad, eggs are good. You tune in this week, and we reported earlier, oh, eggs are bad, coffee's good. If you're Joe Schmo sitting on the sofa watching the news, what are you supposed to take from this?
So I think you take it with a grain of salt initially, and you have to look at not just one pilot study, but long-term studies in humans, and look at it in research centers, and it should be reproducible.
And go to the doctor.
Go to your physician.
And get your checkups. Take it with a grain of salt, but not too much salt on the eggs, because then that's a whole other bunch of problems. Dr. Chaffoo, we thank you as always.
Good to see you.
Thank you.
Time now for your morning weather, powered